much for giving me the opportunity to contribute to this fantastic event, this International Symposium on Climate Change and Health. And thank you particularly to the organisers from Umia University and Gadjah Mada for allowing me to contribute in this way. I appreciate the invitation from Maria Nilsson to give this talk, and I thank you all very much for understanding that I can't be there in person today. It's my pleasure to be able to participate in the symposium using some new technologies, which I understand is a significant focus of the symposium. And of course, we're also saving a little on carbon emissions from avoiding the cost of my flight. So thank you again for letting me contribute. And it is my pleasure to be with you all today. I'm going to be speaking to you about climate change impacts on health, and I've been asked to give something of an overview or an introduction on this topic. My background is I'm an Australian medical doctor. I specialise in remote and tropical medicine and public health. I have a Master of Public Health and Tropical Medicine. I'm currently completing my PhD on climate change and health in Pacific Island countries, and I've been working with the World Health Organization for the last 3 years, focusing mainly on the health impacts of climate change, as well as environmental health and the health impacts of natural disasters. So I'm going to be talking today about the science of climate change and its impacts on health, and I'll mention briefly some of the work that we've been doing in the Southeast Asian region, particularly in Cambodia, investigating the links between climate change and its impacts on health. Could I move to the second slide, please? So in this overview, as I mentioned, we're going to touch briefly on the science of climate change. We're going to explore some of the issues about impacts and the concept of vulnerability. And we're going to review the science of climate change exposures and health impacts, and also discuss what we can do as a community of health professionals, climate change and health stakeholders, researchers, academics, and representatives of the government and non-government sectors to protect our communities from the health impacts of climate change. Please let me know if there are any technical problems with the presentation, if you don't understand my Australian accent, or if you'd like me to speak any slower. Can we go to slide number 3, please? So, as I'm sure most or perhaps all of you are aware, climate change is a global phenomenon that's already happening. But it's important that we all understand the same thing when we're discussing what is climate change. I think one of the best definitions of climate change is that used by the UNFCCC, that's the United Nations Framework Convention on Climate Change, the lead international political body on climate change, who defines it as a change of climate that's attributed directly or indirectly to human activity that alters the composition of the global atmosphere, and that is in addition to natural climate variability observed over comparable time periods. Now, the key points in this definition are that this changing climate is due to human activity and is in addition to the normal climate variability that has been occurring for many millennia, all throughout and prior to human history. Those are the key points. Go to slide 4, please. These are some very simple graphs demonstrating the connection or the correlation, the relationship between global greenhouse gas emissions, specifically carbon dioxide, which is shown in the top graph as parts per million in the atmosphere, and global annual average temperatures over the last 200 years, more or less. Now, as you can see, with the dates on the x-axis, the horizontal axis, both the atmospheric carbon dioxide concentrations and the global average temperatures have increased significantly since around the year 1900 or 1950. Now, this is a consequence of the rapid pace of development and growth in human populations around the world, and the corresponding increase in global greenhouse gas emissions that has caused global warming and climate change. So what we're talking about is changes in the atmosphere that induce rising temperatures and altered rainfall patterns, changing humidities, the frequency and severity of storms, floods and droughts that are all changing, rising sea levels and other effects of climate change that are occurring rapidly and due to human activity, particularly over the last 100 years. If we go to slide 5, please. This purpose of this slide is to say, well, that's very well. We understand the basic science about climate change. Why should we care? Well, as I'm sure you're all aware, the weather and climate affect all of the aspects of our health and well-being in our daily lives, our food, our water, our homes and our health. And the consequences of a changing climate, particularly a warmer climate, will be mostly negative, particularly in the developing world, and that includes most of the countries in Southeast Asia. And those negative effects include substantial negative impacts, detrimental impacts on health. Slide 6, please. Again, I'm sure most of you are aware of the physical effects of climate change in Indonesia, but we'll just briefly review them here. This information is drawn from the IPCC, that's the Intergovernmental Panel on Climate Change, the global peak body for the science of climate change, as opposed to the political organisation, the UNFCCC, which I mentioned earlier. The IPCC predicts that in Indonesia, climate change will cause increasing air and sea surface temperatures, changing rainfall patterns, more frequent and/or more severe storms, rising seas, and that these physical effects will have many other impacts on various aspects of society, including forestries and fisheries, agriculture, and human health. These physical effects of climate change combine with other factors like development, economies, society, geography, and the demographics of a population to give an overall indication of the vulnerability of a community or a country to the impacts of climate change. If we go to slide 7, this goes into a little bit more detail about the concept of vulnerability. As you'll see on the diagram on the left, vulnerability doesn't just take into account the physical effects of climate change, the rising temperatures, the changing rainfall patterns, the changing severity and frequency of storms that we've discussed. It also takes into account how sensitive or susceptible a population or a community or a country is to those effects, and to what extent that population, that community, that country is able to absorb or cope with those effects. And that's a phenomenon known as adaptive capacity. So those three elements combine to give an overall sense of vulnerability to climate change. It includes both environmental and human factors. And what I'm going to demonstrate in the maps that are to follow is how these different layers of vulnerability can be incorporated to give an overall index or a composite measure of climate change vulnerability. In the diagram on the right here, you can see that some of those physical effects of climate change, like cyclone risk, flood risk, sea level rise, can be combined with some of the human factors like population density, geography, and adaptive capacity to give that overall measure of vulnerability, that composite, that index. If we move to slide 8, this is a map of Indonesia, as I'm sure you'll all recognise, with the different provinces shaded according to their overall vulnerability to the impacts of climate change. That's incorporating, as we mentioned, the physical effects of climate change and some sense of the sensitivity of those communities to those physical effects, as well as their capacity to absorb or manage or cope with those effects, their adaptive capacity. This map is from a series of similar maps done by the Economy and Environment Program of Southeast Asia, who published a very important document called Hotspots in 2009, which goes into some detail in describing how different regions within countries and how the different countries in the Southeast Asian region compare in terms of their vulnerability to the impacts of climate change. Now, I'd like you all to consider some of the reasons why these different areas in Indonesia may be considered more vulnerable to climate change impacts, those areas that are shaded towards the red end of the spectrum, keeping in mind that we're not just talking about their susceptibility to physical effects of climate change, but also the social and human fact add to that vulnerability or protect against it. If we move to slide, diagram, although it looks a little bit complicated, is one of the most widely referenced models of the pathways between climate change, represented in the hexagonal navy spot in the middle of the diagram, how exposure to climate change through those various pathways may result in negative health effects, shown in the rectangular box on the right. So by climate change causing increasing temperatures, altered rainfall patterns, changing the frequency and severity of storms, and also through its effect on various ecosystems and human activities, can result in health consequences that will be mostly negative, like temperature-related illness, heat-related illness, increased waterborne and vector-borne diseases, impacts on food security and malnutrition, impacts on mental health, impacts on air pollution, and causing injuries and deaths from extreme weather events. These are just some examples. It's not an exhaustive list. It doesn't describe every possible health consequence of climate change, but it does summarise some of the main health concerns that we as climate change and health professionals worry about and work with communities to try and protect against. If we move to the next slide, slide 10, this table or this diagram is drawn from the fourth assessment report of the IPCC, which was released in 2007. As many of you would know, the fifth assessment report is already starting to be released, and most of its components will be released next year. But this table just shows the overall impact of some of those most common or most predictable health consequences of climate change, and the level of confidence with which this international group of scientists believes that those impacts will occur. So as you can see, most of those climate-sensitive diseases, malaria, malnutrition, injuries and deaths from extreme weather events, impacts on heart and lung disease and air quality, vector-borne diseases and diarrheal disease, the vast majority of those impacts will be negative, and these enormous group of international experts are between medium confidence and very highly confident that these impacts will occur. So you can see that there is a very good reason for us to be concerned about these effects and trying to address them to protect our communities from the health impacts of climate change. If we go to the next slide, this shows a map of the world divided up according to the WHO classification of regions, which shows the extent to which each of the regions will be affected by climate change, or in fact has already been affected by climate change in terms of health impacts. Now, I'm sorry the table at the bottom isn't very clear. The reason I've circled it is that the Southeast Asian region, partly because of its very high population, is, as of the year 2000, already experiencing the highest burden of climate-sensitive disease in the world. The measure here is Daly's disability-adjusted life years, which is a measure of health burden in a society. And even in terms of the health burden expressed as a rate per population, Southeast Asia is the second highest in the world after Africa in terms of the overall health burden caused by climate change as of the year 2000, so quite some time ago. If we go to the next slide, this shows two different maps of the world, with the top map showing all the countries in the world divided up according to their level of greenhouse gas emissions in the year 2000. That is the amount of carbon dioxide that they emit. As you can see, the countries that emit the most greenhouse gases, like the USA and China and Russia, are shaded in red and brown. And some of the poorer countries in the world, developing countries in the world, like in Africa, South America, and Southeast Asia, are shaded green. Now, compare that to the map of the world down below, which shows the burden of disease caused by climate change in that same year, with that health burden only made up of 4 climate-sensitive diseases: malaria, dengue fever, diarrhea, and malnutrition, with some consideration of flooding and heat waves, but that was only in some countries. As you can see, the maps are almost reversed. That is, the countries that emit the most greenhouse gases are not the countries that experience the highest burden of disease due to climate change. And those countries that do experience the greatest health burden due to climate change, so that's the countries shaded in yellow, orange, and red in the map below, are among those countries which have contributed the least to the problem of climate change due to greenhouse gas emissions. If we go to the next slide, slide number 13, this zooms in a little bit on one of the countries in the Southeast Asian region, in some of the work we're doing in Cambodia, where we're examining the relationship between historical temperature and rainfall patterns and diarrheal disease in the different provinces of Cambodia. And what we found in looking at the last 20 years of climate and diarrheal disease data is that the strongest relationships exist between temperature and rainfall and diarrhea in those communities in Cambodia that are densely populated and live around the Tonle Sap river system. Now, the importance of this finding is that those are also the communities that are likely to be most affected by the physical impacts of climate change as Cambodia becomes hotter and has drier dry seasons and wetter wet seasons. So the areas shown in the pink circle, the pink oval, are those that have already the highest burden of climate-sensitive disease and are among the most vulnerable to climate change. So this is where that idea of a climate change and health vulnerability index, like we looked at those maps earlier for Indonesia, can be used to prioritise some measures to target those communities that are most in need. If we go to slide 14, the purpose of this slide is to make the point that when it comes to the health impacts of climate change is most likely to act as a multiplier or an amplifier. Rather than bringing new risks to health, it will make existing health risks worse. This is a common mistake, particularly in the media, that people believe that climate change is most likely to bring in new diseases rather than just making existing health problems worse. If we move to slide 15, and I'm nearing the end of my presentation, there's 2 concepts that I want to review with you, or perhaps for some of you, these may be new concepts. They're the 2 main strategies that we talk about when it comes to decreasing the impacts of climate change. The first one is adaptation. Now, this is the concept of action taken to cope with or manage the effects of climate change. And some of the examples in the health sector are improving communicable disease surveillance, primary health care, public and environmental health, improving infrastructure or technological innovations, carrying out research or building human resource capacity. So adaptation is accepting that climate change is happening and managing those impacts as best we can, as opposed to mitigation, which is trying to slow, stop or reverse the effects, the process of climate change itself, namely by reducing greenhouse gas emissions. And on slide 16, I've just mentioned a couple of the research needs with respect to climate change and health worldwide, and this includes the Southeast Asian region. I know that this is going to be discussed in more detail during the symposium, so I just thought I'd briefly mention here that we need to really invest time and effort and resources into investigating these relationships between historical climate variability, climatic factors such as temperature and rainfall and humidity, and these climate-sensitive diseases like malaria or diarrheal disease or malnutrition, so that we can better understand and estimate what health impacts may come with future climate change. We also need to trial some of these adaptation measures to protect communities from the health impacts of climate change and evaluate these strategies to ensure that they are effective. And of course, it's an ongoing mission for us to educate health professionals, government workers, policymakers, and of course the public about the health impacts of climate change so that they can take actions for themselves and for their own families and their own communities to minimise the impacts, the negative impacts of climate change on health. So that's the end of my presentation. Slide 17 is just questions and discussion. I'm happy to take questions now, or perhaps, as I understand, the session may be structured that we all take questions together at the end. Thank you very much for your attention. Thank you again for giving me the opportunity to contribute. And that's the end of my presentation this morning.
Thank you very much, Dr. McIver.